Now let's get to a segment of the show we like to call What's Up, Doc, where we spend some time with the experts from Mercy Health, and this morning is no exception. Radiation therapy is the topic, or treatment, cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Lower doses radiation is used in x-rays to have a look inside your body, teeth, bones, all that. Well, we need someone to explain the ins and outs of that, and we have just the person for you. Dr. Gregory Richards, radiation oncologist at Mercy Health Cancer Center here in Rockford. Dr. Richards, good morning.
Good morning, Riley and Joe. How are you guys doing today?
We're great. How's everything going with you?
Going great. Now that the vaccine's coming out, hopefully in a few months things will be calming down.
Yeah, there's that to look forward to, and not just one vaccine, but, we got, 2 more on the horizon about to go through their testing phases, right?
Yeah, so hopefully, as they get to distribute these and patients receive them, people receive them in the community, hopefully a year from now or even less, things are getting back to normal.
Dr. Richards, tell us a little bit about yourself. Give us some background on you.
Right. So I'm a cancer doctor, which means after 4 years of medical school, I went through additional training. Now, as a cancer doctor, there's usually 3 different types that a patient might interface with. One is a surgical oncologist, or a doctor that removes cancer by surgery. The other type is a medical oncologist, which is a doctor that treats cancer with medicine therapy. And I'm a radiation oncologist, which means I'm a cancer doctor that treats cancer with radiation therapy. So after medical school, we do a 5-year residency, and then we start treating patients with cancer. And so what I do is I see a patient who comes to me for advice and review their case. Normally they've already been diagnosed with cancer, and then I talk to them about treatment options. And the main thing I'm usually discussing with them is radiation, if it's required in their cancer, and if so, how do we go about doing it, and what's the process?
One thing we ask all of our guests on this show, and is just to make sure that we actually like you. You've done good so far, so you started off on good foot. But where'd you do your undergrad?
I did my undergraduate at the University of Connecticut, and I did my medical school at Rutgers, New Jersey Medical School. I'm from the New York area.
Very nice. Yeah, that's acceptable.
Is that acceptable to you?
Yeah,
as long as he didn't say Duke or Notre Dame, he's okay.
Pretty much, or Indiana.
Oh, okay.
Throw that one.
All right.
Throw that one on the pile, too.
Fine. His educational bona fides are good here.
I did my residency at the University of Wisconsin, so there is some Badger in me. I'm not sure if that's good in these parts or not. It's always a little bit tenuous, but...
I'm down with Madison.
Yeah, we can be okay with that one.
That is fine.
How did you get into cancer care specifically?
Yeah, so even as a young child, I was always interested in helping people, and I loved science. I was kind of a bit of a science fiction geek, and so growing up, as I got into college, I felt that science and helping people, the best way I could do that was becoming a doctor. And so in medical school, as we rotate through different specialties. Whenever I had a patient who happened to have a cancer diagnosis, that always, really touched me, touched my soul, touched my heart, and I felt that I could use, my skills the best taking care of patients who were diagnosed with cancer. And cancer is probably one of the scariest words in the English language, and so every day I'm humbled as I get to help people with cancer. So it's an absolutely fantastic field to work in. It's very humbling. But I get to use my skills to help people.
I unfortunately have firsthand knowledge with you people, cancer doctors. I diagnosed with cancer. We were talking about the time frame. I'm not really sure. 3-4 years ago, something like that.
Yep.
It's testicular cancer. Everything's fine now. But one of the things that through my treatments, I didn't do any radiation. I just did chemotherapy, about the 6-week regimen, something like that. When does that decision get made if you're going to go through radiation or versus chemotherapy, or both for some people?
Yeah, and so I think the first thing to answer that question is take the word cancer, because people think of cancer as one disease, and cancer it's a very varied disease. I mean, there's over 32 trillion cells in the human body, and what cancer is when one of those cells starts to grow abnormally after acquiring lots of mutations, and so you can get cancer of many different parts of your body. The most common solid tumor in women would be breast cancer. The most common in men would be prostate cancer. But as you mentioned, there's testicular cancer, lung cancer, and so whenever someone gets diagnosed with a cancer, we have to assign a stage to that, which means we look at how advanced is the cancer, where it originated, has it spread anywhere? And so once we have the type of cancer and the stage, then there's paradigms on how to treat that. So some cancer treatment will involve radiation therapy, some won't. So, for instance, testicular cancer, most types of testicular cancer will not involve radiation, although there are some types that do, and it depends on the stage.
You know, looking at your bio here, I'm over on the website, and you point out that this is an incredibly troubling time in a patient's life when they've been diagnosed with cancer, filled with anxiety and fear of the unknown. You meet patients, you spend as much time as they need discussing history, potential treatment, and all that. What you do is a lot more than the radiation therapy, though, because part of it is helping to eliminate the unknowns and reducing that anxiety and fear. It's a lot more than I'm working on science here. Somebody else can work toward the mental aspect.
Yeah, absolutely. You know, I'm lucky here at Mercy Health. We have an amazing comprehensive cancer team. So, you know, not only when they come to see me do they see me, they see our caring nurses. We have social services. We have nutritional services. We even have massage therapy. And so we get to address not only the disease, but we get to address the person. And so, you know, I may be creating a radiation plan for ours specifically treating a prostate cancer, but we're also talking about, you know, how are they going to get to and from treatment every day? Do they have rides? Do they need to be set up with people? Can we help, you know, them incorporate their friends and families? You know, what are their nutritional needs? How can we help them get through the treatment better? And so it's a very comprehensive approach. And, you know, I think most of our patients are very, very, they come in very scared and they leave usually a lot less scared because a lot of those unknowns have been addressed. And it's really a team effort.
How has your field changed in the last 5, 10, 15 years? What's new and better?
Yeah, and so my field has changed dramatically over the last 20 years, and a lot of that has to do with computing power. You know, in the old days when what I do is I take radiation therapy and I'm trying to treat a tumor with that. And most of the time, you know, the vast majority of people that get radiation therapy get X-ray beam radiation therapy. So there's a machine called a linear accelerator that creates radiation therapy. And how that machine works, the advancements over the last 10, 15 years has been incredible. In the old days, it was kind of like they would just point the machine at an area and just deliver the radiation, hoping that they were hitting the target that's inside the body that they couldn't see. With advances in imaging technology and advancements in the way that machine works, we can now pinpoint things and have the machine move very specifically and treat very specific areas while avoiding other areas. And so what we see is we see much less side effects in patients, and we see overall better outcomes. And so, you know, these advances, when people talk about, you know, my aunt had radiation 20 years ago, radiation oncology is a much different field due to those advancements in technology.
What happens, Dr. Richards, when radiation meets cancer cell?
Yeah, so radiation therapy, ionizing radiation therapy, its job is to induce molecular damage. And so when that radiation, the vast majority of that damage is when the radiation affects the cancer cell by doing damage to its DNA. And when we do damage to a cancer cell's DNA, we limit its ability to divide and grow. Cells, you know, one cell begets two, which begets 4, 8, 16, and so on. And so if we're able to stop that cell from dividing, then we can prevent the tumor from growing. And then as we kill more of those cells, we eventually can kill the entire tumor. And so really what we're doing is trying to take a tumor filled with cells that are growing uncontrollably and stop those from growing by inducing specific molecular damage to prevent them from creating other cells.
A question very timely here. With COVID-19, have you had any patients undergoing radiation or with cancer diagnosis that also had COVID, and how does that affect?
So we have not had any patients in radiation oncology here in Rockford that have been diagnosed with COVID while undergoing treatment. But COVID in general has affected the field of radiation therapy somewhat dramatically. And so, for instance, when I deliver radiation, patients are usually treated every day with a small dose of radiation. So, for instance, someone with breast cancer may need to receive 25 treatments once a day, 5 days a week over the course of 5 weeks, or someone with prostate cancer may need 44 treatments. There are other types of treatment regimens where we can sort of lower the number of treatments, and so they have less exposure to coming in and out of the clinic. And so we can change the way we deliver radiation therapy to minimize patients' exposure. So when there's a stay-at-home order, order on the state. Maybe they don't have to come here as often. Maybe we can change, the amount of exposure they get to the medical system. But we have not had any patients with COVID, but we have plans in place. If they do get that, how do we approach that?
You mentioned the, throwing out, my aunt had radiation 20 years ago and all that. Compare radiation therapy results now to what you looked at 20 years ago. And if you could, what are we looking at down the line?
Yeah, and so I think radiation cancer care has improved tremendously, and so results are better as far as how we treat tumors, and the other big thing is really side effects are a lot better. And so, for instance, your aunt undergoing treatment, she may have had a lot of side effects that she wouldn't normally experience today. So, for instance, someone with breast cancer, they may have a less skin reaction, they may have a much lower risk of getting arm swelling, which in the old days they used to take out a lot of lymph nodes, and we used to have to deliver high dose to regions where those lymph nodes were. Now we take out less lymph nodes. We have more sophisticated ways to deliver that radiation. So the side effect profile as far as what radiation was then and now is much different. And actually the treatment as far as control is much different too. In the old days, for instance, someone had a small lung cancer but couldn't go through surgery, we would give a very prolonged course of radiation therapy to them. Nowadays, we can deliver highly focused radiation because we can target that tumor even as it's moving in the body, and we can deliver much higher dose of radiation and fewer treatments and get overall better outcomes. And so the technology is quite incredible. And then, my counterpart, the medical oncology team, the advancement in drugs has been quite amazing. And so if you look at drug therapy, as far as side effects and overall efficacy is improved greatly. And we talk about, molecular medicine, which is sort of what they're doing now with this mRNA vaccines, with COVID. We have some of those types of technologies where we're using molecular medicine to treat cancer. So really, it's an exciting time in cancer care, both from an overall outcome, improving outcomes, and in reducing side effects.
If somebody out there has that unfortunate day where they go to the doctor and get the cancer diagnosis, what are some questions they should ask that they might not think of?
Yeah, they need to ask basically who's going to be involved in my cancer care, what type of cancer do I have. I mean, so you'd be surprised that patients, sometimes they don't even, they come to me not even knowing the type of cancer, but what type of cancer do they have, what is the stage of the cancer, and what's going to be involved in the treatment. And I think they should always ask what type of ancillary services, do they have at the cancer center. Will they be able to see a registered dietitian? Will they be able to speak with a cancer-trained clinical social worker? What are, because as they go through treatment, there's going to be bumps in the road, and how are those bumps going to be taken care of?
Outstanding. Dr. Richards, we know you're busy. We're up against the clock as well. We appreciate you carving time out of your day. Very, very educational. It's great to hear about how things have progressed and how we can look forward to things progressing as well, and knowing that there are people right there just like you waiting to help.
Well, thank you guys very much. I hope you have a great rest of your morning, and please stay safe out there.
We'll do our best. Thank you. That's Dr. Gregory Richards. He's with Mercy Health, and he's a radiation oncologist.